thank you for joining the Consensus Health Stop COVID-19 Hackathon. I am absolutely delighted to announce our winners today, give our judges the opportunity to communicate their thoughts and their findings. Some of our goals for this event were to bring together healthcare and life sciences experts with next generation technologists. We're very proud to have aligned 3 different open source software communities with Hyperledger, Ethereum, and OpenMind, and to bring together domain experts from healthcare and life sciences. So some of the most exciting highlights from this more than 3-week-long effort are that we have brought together 500 participants, more than 500 participants from over 70 countries around the world. We have activated 50 volunteer healthcare and life sciences mentors and delivered over 80 hours of free blockchain education through the Consensus Academy. There have been more than 30 hours of education sessions spread across these 4 weeks, and we had more than 40 project submissions. Before we get started, I'd like to very quickly let you know who our esteemed judges have been for these projects. Joe Lubin, co-founder of Ethereum and founder of Consensus. Brian Bellendorf, Executive Director of the Hyperledger Foundation. Jose Arrieta, Chief Information Officer and Acting Chief Data Officer of the U.S. Department of Health and Human Services. Michael Akinyele, Chief Innovation Officer of the U.S. Department of Veterans Affairs. Dr. Cheryl Pegas, President of Consumer Health Solutions and Chief Medical Officer for Cambia Health Solutions. Dr. Alex Kahana, Chief Medical Officer and EMEA Market Lead for Consensus Health. Dr. Sean Mannion, Chief Scientific Officer for Consensus Health. Dr. Jonathan Holt, Chief Medical Informatics Officer for Consensus Health. And Debbie Bucci, our Director, Patient Mediated and Institutional Data Exchange at Consensus Health. So now, for the awards, we have to begin with the 3rd place. And this was very difficult decision and extensive preparation. The 3rd place winner is the Decentralized Pandemic Reserve.
One of the biggest issues right now is that the way that we're calculating and accounting for spread is kind of just looking at new cases in versus new cases out, and that's problematic. What we were able to build is a true R value that's taking into account several different factors that affect that spread number, including population, social geolocation tagging, what does global mobility look like, what does hospital beds and ventilator beds for each city or area look like, confirmed positive cases versus cases that are confirmed with symptoms, what policy action was taking place and when was it implemented. We're looking at cases not only by country but by state and overall global cases to understand what that true R value is. And what that allows us to do is to get the suppliers who have the products to the places that they need them. The Decentralized Pandemic Reserve is a DAO, and so it's a consortium. So it's of hospitals in need that can come and go to our platform all in one location asking for resources or supplies, but it's aggregated by triage and world demand. And so then the platform assesses the need against data models of activity to deliver the supplies, with the hope that at the end of it all, we'll have such a sort of well-rounded 360 view of that data and of that R value and of that spread, that our true measure of our effectiveness is that our community no longer has a need.
Alex Gardner, I'd like to invite you to come on the line and have the opportunity to react to the judges' feedback. I'd like to open it up with you, Joe.
Sure. So this one was actually my favorite. I thought it was very thoughtful, uses real-world data, and is preventative. So if we can build a system like this that can be applied early in an event, then maybe we don't really have an event. Great stuff.
So to echo what Joe said, I like the use of data. I think that we ultimately have, if it works, a system that could ultimately help us be a little bit more proactive. What I would sort of think through about next steps is really how you drive adoption and sort of bringing folks into the platform, because ultimately a lot of these systems and the way they currently operate have existing tools and solutions in-house, and so integration to anything else becomes one of the first questions that comes up. when something new is introduced or considered. And so thinking through how an EMR or anything out there could ultimately serve as a feeder into this, to make it simpler for adoption might be another way to think through how this or something like this gets set up.
It was my favorite too. So congratulations, Alexander. Not just because you're called Alexander and I'm Alex, but it was really great. And what I liked about it is not only the concept of R, which I understand from my epidemiology studies, but also the fact that you integrated a DAO and a voting system in it. I always think that when we try to, let's say, incorporate governance into whatever data management system is, it just makes it more robust, and it introduces the idea of crowd intelligence and I would say skin in the game. So kudos for that, and I hope to see many more DAOs in the future in healthcare.
An awesome project. Thank you. I'm very glad to see this one come together. I think the value in it is envisioning how you bring the different stakeholders together. And I think it's also going to be a challenge, but that's where this really starts to drive value, because if you've got a centralized system where one person or one unit is dictating how these resources are spread around, you're always going to have lag, you're always going to have lack of knowledge. But with all of the stakeholders at the table, that's going to allow you to get a much more balanced and real-time movement of the necessary goods and supplies to where they are most needed. So well done.
So we're obviously doing some work around this specific example right now. I would just say, so I love the concept and the idea of it, right? And I think, but the challenge you have, and having been working with a number of distributors for the last, 10 weeks, the challenge you have is how open the medical distributors will be to actually sharing some of the insights that you need to move the data or to move the product around to different systems. And I think, from an adoption perspective, being able to, when you build like a 3 or 4-sided platform, it's really hard to get all sides to kind of adopt and accept it. But if you build something that adds incentive or value right away to at least 2 parties of the 3 or 4 sides, it's much easier to start to pull in the other aspects of the ecosystem that you're trying to interconnect. And so I really like this idea a lot, and I'm living this idea, literally. But I think that is the biggest challenge that you'll face when you try to kind of implement in an ecosystem like this. And so figuring out a way to immediately add value to 2 of the counterparties in the network itself, I think will help, bring something like this to fruition. And that's the one, I didn't think there was an area within where you could provide feedback to kind of give that feedback. I thought, in the buckets we looked at, the team did a really good job of hammering each of those areas, but that go-to-market strategy, I think that's the one area that I would focus in on if I were going to run with this. So that's my feedback.
Alexandra, you were going to comment.
Well, we just wanted to say thank you. Like, it's obviously an honor to, be a part of this and to make it as a finalist. The feedback that we've received is amazing. What kind of got us down this path to begin with is that adoption. How do we help manufacturers or suppliers that are making, perfumes at Louis Vuitton, and they're now repurposing their supply chain to make hand sanitizer, or Crocs is, starting to make medical gowns. Like, we saw this need of pivoting creates a lot of sort of barriers to resistance, because a manufacturer or supplier is now having to live and exist in an ecosystem where they've never really been a part of that logistics and that supply chain. And so I'm happy that you brought that up, Jose, because it's something that we've thought of would definitely be a barrier to entry. Is, will there be resistance from medical manufacturers who might not want to share this space, or only want to share it during the course of the pandemic and then shut it off after? How do we share that intellectual property? How do we kind of make this so that everybody's playing nicely with one another and moving supplies and materials as quick as possible. So that feedback's amazing. It's definitely given us a lot to think about. We do see a lot of value in this, so it makes our team happy. Everyone's freaking out. They're like, well, we were a favorite. So we're going to take all of this and definitely, you know, rethink it, re-strategize, look at our adoption strategy. So this has been a really amazing experience, and thank you so much.
And Alexandra, I'll just make one more comment, and it just to kind of like, the price point is really important to that community of folks, right? And so, you know, they are still capitalistic entities, and regardless of how we think that they'll behave in the event of a pandemic, so the change in supply and demand actually changes the price with which people will pay for item, right? And I think that's the big, you know, the big challenge that you kind of run into with the model. I actually think there's some ways that you could really kind of gain adoption, but I think that's the big challenge. But you know, I love the idea. If you focus in on that piece and you figure out a way to solve that piece, this is infinitely scalable, and it fundamentally changes an entire ecosystem. So kudos to you guys for pushing on it, but just focus on that piece, because from their perspective, that's their risk.
Mm-hmm.
Definitely underscores new priorities around resilience and adaptability and flexibility in supply chains in a model where historically we've only sought to maximize efficiency in relatively static infrastructures. So really, really an excellent approach. All right, so any last opportunity for judges to discuss a decentralized pandemic reserve?
Sure. So I have a question, and let's go, Alexandra, other judges. So what are we thinking could be a very effective incentive model for something like this to, you know, bring the stakeholders to the table? Or would it require government action, sort of directing stakeholders to essentially adopt this? And would that actually work?
Well, and so that's one of the biggest challenges, right? Is that we know that there's a need. We know that, especially in the United States, we were so underprepared in terms of having supply aggregated and pushed towards the areas of greatest need. And how do we determine that? And to Jose's point, right? Like if we start to flood the market with certain supplies and then costs start to fluctuate, we're going to have sort of a resistance or an interference from people who do play in that sort of scope. So it's difficult, and it's one of the biggest areas that we need to think about. I mean, that's one of the beauties of the DAO, and we've seen this from especially the Ethereum community. People are willing to stake their own tokens, and that's part of the DAO, right? Is that there's a financial cost or burden to you to be involved and create sort of that vote. I think the way that we can get stakeholders involved is just the community. We've seen it, especially in the United States. Like I'm locally from Michigan originally, and I watched my state get completely screwed. And that was really, really hard to watch because of political biases of whether or not they were going to receive the supplies that they needed. So I think there is definitely a push to get that sort of decision-making power out of the hands of the government and back into the people. And there's a little bit of a revolutionary component to that. And how do we do that without creating, you know, a major uproar? But I think that's kind of why you can get buy-in, is that the whole goal is that we are removing that political bias and giving that decision-making power back to data and back to people. And so I think with that alone, we can get people onboarded. Now, we do obviously have the challenge of, you know, suppliers that work in the medical space and allowing them to share that space with us. There might be incentives, there might be sort of, you know, co-business operations. We're going to have to find that sort of tit for tat trade that everybody feels like there is the incentive to be involved, at least at that level. But I think from a community perspective, there is a need to remove government biases from decision-making platforms, and that's what this provides.
Thank you, Alex. And we're almost out of time on this one. I would love to give our other member of, you know, in a public sector position, Jose, an opportunity to react to Michael's question about whether and to what degree legislative, regulatory, or policy interventions would be needed for the decentralized pandemic reserve to take off.
Yeah, I think that having, as some of you know, tried to implement a blockchain, a functioning ecosystem within a federal environment, I think one of the things that I learned is that is that it's probably better to do it in a two-step process. And so I think the first step in the process is getting folks now, right? Because I tried, and this is kind of the lesson learned, right? So I think the first step is getting folks comfortable with data sharing within whatever the ecosystem is. And I think the second step is then, educating and making them comfortable with this different way of doing business, which fundamentally changes their business model. And I think if you try to jump all the way to the fundamental change in the business model first, you'll end up with a lot of resistance. And I'll just give a little example to Alexandra's point. The question over whether the federal government should maintain reserves for the entirety of the 8,000 hospitals that live in the United States is an open question. I'm not gonna go there and debate it. But I will say this: at the end of this pandemic, multiple hospitals will load up on N95 masks, and they'll go into a closet, and the accountant's going to roll through and look at that closet in 3 years and say, "Why are we storing all these N95 masks here?" And they're going to take that inventory from X, down to zero, because from a business perspective, that's having some level of impact on their balance sheet, and it's obviously something they're not using, right? And so you have to start to decouple why the business is acting in that way, and then figure out a way where you can kind of add value that relates to the way that they're managing, in this case, the hospital system itself, right? And you can't, I'm not going to go and tell a hospital system, you must keep 3,095 masks available, right? So that's the piece that you have to solve for. And I think there are ways to actually address that. And if Alexandra wants to talk about it, she can shoot me an email. I don't know that I want to openly discuss it on this recording. But I do think it's a very compelling idea. And I think from a business model perspective, you've scratched the surface of something that could be truly transformational. Just get a little bit creative around understanding the fact that this fundamental change in the ecosystem, before you do that, you have to understand the incentive structures that drive behaviors within each of your stakeholder entities first. And if you do that, I think you'll come to a conclusion where you can actually implement this. And I think it'd be pretty disruptive if you were able to successfully do it.
Thanks, Alex, and thank you, judges, and congratulations again to the Decentralized Pandemic Reserve. So I'd now like to introduce our second prize sponsor, Leidos, and particularly Ed Benjamin, in order to introduce our second place winner.
Well, good afternoon, and thank you for this opportunity to participate in this really vitally important forum for innovation to confront COVID-19 head on. So as Heather mentioned, my name is Ed Benjamin, and in my role as Vice President at Leidos, I serve the Department of Health and Human Services, as well as the Social Security Administration. Many of you may not know, but Leidos brings a long history of solving the nation's most difficult problems through science and innovation. And simply put, our mission is to make the world safer, healthier, and more efficient through information technology, engineering, and science. Leidos was founded in 1969 by Dr. Robert Beister as Science Applications International Corporation. And from our earliest days, we've supported NIH and other HHS agencies and are committed to those missions. In 2013, we became Leidos, which is a name that comes from the middle two syllables of the word kaleidoscope. And in 2016, we now have 36,000 employees supporting health, defense, intelligence, and civil government markets. From the start, though, Leidos has been engaged in bringing science to solutions, which is why it's so exciting to participate in this event. Leidos is heavily engaged in blockchain innovation from an R&D perspective in the US and abroad, as well as in collaboration with our clients in HHS and operating divisions, as well as DoD. Our ongoing mission-focused efforts include incorporating blockchain into our software factories, solutions that we're developing with HHS in support of AI, ML, and advanced technologies, the award-winning health information exchange that we've developed using blockchain, and using blockchain to help advance the nation's battle against COVID-19 in a number of ways. So with that, I'm really excited to announce the second place winner. Second place winner in the COVID-19 hackathon is decentralized supply chain.
There is a shortage of basic supplies that are needed in order to face up to the COVID-19 crisis. So what we've seen in Athens is that there's been a wave of solidarity, and there's been teams that are self-organizing in order to produce these items. So what we want to build is a way to be able to track the provenance of what is being created, and if something goes wrong, they'll be able to see that straight away. We're using smart contract architecture to be the accountant of decentralized supply chains. And the other very important layer is the social layer that we are building out and focusing on. Here's our wireframe for the Telegram bot interface for the app that we're building. That makes user experience super simple. You don't even have to log in via Web3. Hellas COVID 3D printing group, which is one of the examples of a group that is doing this decentralized supply chain creation of masks. And if we build on that idea to make it more effective through blockchain and more scalable and more of a project that can be linked to social campaigns and have these positive feedback loops between everyone involved, that we can really supercharge these kinds of operations.
Okay, judges, I'd love to start out. How about with you, Jose, about your comments on decentralized supply chain? And then I'd also like to ask Michael and Brian and Dr. Khanna and other judges. Let's have an open conversation. And James, you're representing decentralized supply chain. Congratulations to you.
That's right. We're absolutely thrilled. It was something that we felt that we needed to build very urgently, and we really grasped the opportunity of this hackathon to build it. So we're just thrilled. Yeah.
Well, thank you. So I'll let you open up, Jose.
I really like this one a lot, and the reason that I liked it at the highest level is because I thought Hellas, or the 3D printing group that you guys identified, I thought, you're using the blockchain and the traceability accounting capability of it here to essentially bring a market participant to the market, right? So if you have a need for supply and you're a hospital system and you're responding to an event like we're currently dealing with, and you cannot find those supplies, well, what you need is somebody to actually provide visibility that they actually exist. And so what you've done is you've created a mechanism for a small market participant that normally would have been squeezed out of a market by a larger entity that maybe controls the supply chain, and you've created connectivity for them through through the application itself to actually offer their supply directly to someone that's in need. So I think it's extremely disruptive. I think you've created a mechanism for an incentivized, motivated group of folks to offer a solution to a problem. And then that problem is a problem that, the system itself is facing. You've given them an avenue to solve it. And so I love that as a starting point to be really, really disruptive. And I'm not going to say that the existing players in the market are monopolistic in nature, but if you think about that ecosystem as a whole, it's very it's set in concrete, the way it functions, the way it works, the terms and conditions associated with their contracts and the way that they buy. And you've now created an avenue outside of that ecosystem to get what I need in the current event that I'm in. And I think that has staying power and scalability across that entire sector, as long as you can find incentivized market participants who want to be disruptive and need a mechanism to do outreach to the buyer, in this case, the hospital system. And if you do it really well at the beginning, it becomes very disruptive even after the pandemic subsides and we all can eat in restaurants again. So I love this idea because of that specific aspect of it.
So I really, really like this one. I'd say it was my favorite. And part of the reason, I won't repeat everything Jose said, but it's all the things he said. And then the component of this where I think it empowers individuals and sort of smaller communities to take action and really create, whatever is needed. So the use case here is PPE, but ultimately I think part of what was presented is this sort of platform, the smart contract relationship can essentially let off what is ultimately groups of people that are designing solutions to meet the needs of others. And those needs could vary. So PPE today, it could be helping individuals get their groceries. It could really be anything. And ultimately earning some social capital along the way that I think could be in its own a way we could also sort of encourage folks to adhere to certain guidelines around social distancing or just whatever the orders are to help slow this pandemic down. And so if there's a component of earning social capital, in addition to the component of being able to meet some needs around physical or other demands are out there individually or at an enterprise level, I think this is something that could scale in a meaningful way if all the pieces are put together in the right way. So I'm really excited about this one.
I do like the aspect, the idea of making supply chains more elastic. Traditionally, as you automate these supply chains and make them just in time, you make them more brittle. Harder to adjust to these changes. Just look at what's happening in the food supply chain where, because restaurants aren't buying food anymore, things are kind of falling apart for the farmers, and yet we're still having trouble buying things. So to the degree that this makes the supply chain around PPEs more elastic, more able to respond when new people suddenly have a lot of free time in their hands and are able to help with the efforts, that's great. I think the thing to be careful about, and this was a concern I had with the last one as well, is kind of crowdfunding processes sometimes work really well. Sometimes they can be gamed really well too. You see that on some of the big crowdfunding websites where the more visually appealing projects, the ones that tug at the heartstrings a bit, might get the money rather than the ones that actually can have bigger impact. And it's hard to know ahead of time, especially somebody kind of voting on these things. And so it has to be kind of carefully designed to avoid falling into simply the more popular trap versus what's going to actually have the biggest impact when people are there to figure out where to allocate their donation money, or if it's a part of a supply chain, the purchase money.
What I like about this is there's a community aspect to this, and the focus on health systems, even if you look at PPEs, probably not the place I might prioritize, right? I might prioritize places that have the highest cases because they're not necessarily related to health system, but they are the physicians in those communities or the workers in those communities who have needs, who may not have access to solutions or a place to go. So there's a bit here of how do you engage those to know you exist and that you're a source for them at a price point that allows them to be able to manage it within their communities. This is less about how do you stockpile, but really how do you allow yourselves to collect that initial data of the needs of a community and be able to then provide those health solutions that they may need. PPEs are one of them, but 3 months from now, it's flu vaccines. And so how do you understand kind of within this environment what the needs are and have that data-driven strategy to allow you to have your business survive, but also have an impact on the care that you're looking to do with a way of always including others in it. I think Brian's comments about, if something looks great, you get a lot of input. I think it's an opportunity for you to ensure that you've got the right team behind you to almost tell your story as opposed to you telling it alone. So what are the right blog posts, the right meetings that you're in to share this? And some of this can be with academic medical societies, if you think physicians, nurses, respiratory therapists are the ways you want to go. But don't just think the technology itself matters here. How you tell the story and how you engage, frankly, it's what we're seeing with this pandemic, right? It's about 50% of healthcare, and really ensuring that you build a business model that way allows you to succeed and be sustainable.
So I agree that the community or local focus made this particularly powerful. Consensus had a group of people early in the pandemic who identified a need for PPE in the US with hospitals and firefighters, and figured out ways to source it from overseas. And we used our supply chain track and trace project TRIM because there wasn't a lot of trust. And so as Brian indicated, it was actually a much more brittle solution than I think this one was. I like the use of the 3D printing capability and the local focus. And I think while that system can be global, it probably functions much better locally, and it's just a better solution.
As someone who comes from the Middle East and is responsible for EMEA, I was just really excited to see that this is an international group, and that to remind everyone that we had participants from 70 countries. This is a global effort. This is a global hackathon, and any solutions that come in from places that lack infrastructure and just leverage social capital and inclusion is a winner for me. So kudos and shout out for the Middle East.
I love the hacker mentality of not just staying idle, but actually I have a 3D printer. I'm going to get in this fight and help out.
Yeah, absolutely. Absolutely. Congratulations, James and the decentralized supply chain team. We're delighted to award your second place prize. Thank you for all of your efforts. Okay, so we are now ready to move on to announcing our first place winner. And this was such a hard decision, such a very, very challenging decision. And we're very proud to ask our first prize sponsor, KPMG, to introduce this. And so I'd like to ask you, Tegan Keel, to please go ahead and do your KPMG introduction and announce our first place winner.
Thanks, Heather. Well, we were so excited to be able to be a big part of this and support everything you guys are doing. These are fascinating, and it's been really exciting to watch these evolve over the last few days. And I think, in general, like a lot of companies, KPMG is doing significant work right now to help our clients adjust to sort of what we're calling the new reality that COVID-19 has created. And part of that includes everything from helping states lay the foundation to reopening, to helping plan for eventual vaccine distribution, to just, helping our clients adjust to what their current operations, to what this new digital future will look like. And part of one of the things we've been looking at has been sort of the impact and the possibility around convalescent plasma therapy. And so I'm very excited to say that the winner is D-Plasma.
One person that already got infected with COVID can transfer their antibodies, which live in the blood plasma, to someone else. Once you deal with blood components, you also deal with a lot of genetic information and DNA. And this information must be super secure. We build a quick, reliable, and privacy-preserving matching mechanism that will work globally, and that's going to be very easy to use. The app would act as a facilitator using verifiable credentials. So thanks to public-to-private key infrastructure, we can authorize only the hematologist to make that request. So the plasma bag request can only be a button activated by the hematologist, and that's what our smart contract does. And the blood bank can verify that that signature is coming from the hematologist and signed with the hematologist's private key. What we do have today happens behind the scenes, people using telephones and making manual calls and asking for donors to go to blood centers urgently because they do have particular blood types or particular components in their blood. And I honestly think that this should not be tied to the city where you pay taxes. This can help save lives anywhere in the world.
All right. Thank you very much to the D-Plasma team. Yeah, right. We're really excited to talk about this one. Let's start out with you, Dr. Pigas. I know you had a lot of thoughts. Let's open with you.
This one for me just really speaks to needs that we probably had 10 years ago, heightened during this time. How do we ensure we have a system that rapidly allows experts to share information and then be able to find treatments for patients? And for many of you, you're aware of our transplant system, which has a lot of holes in it. For hematologists, they really don't have a place where they can go share this information in a secure manner and then be able to leverage services that they may need. So really, really loved these pieces. I also thought it was very thoughtful in acknowledging all of the boxes that have to be checked for this to be successful. It's not just personal genetic information that's being shared, it's personal health information. There's a huge privacy security component of this that you really need to have healthcare professionals buy into. Acknowledging that up front, I think really speaks to how you will have an impact, because it is the first question that will be asked. I also think that this is a system that is translatable across multiple other conditions. I like the focus here though. Convalescent plasma is the focus. Trying to do everything does not make sense from your business perspective as you begin in what you're doing. Allowing yourself to have hematologists as experts to support you early on will really allow this to scale successfully. You will find a ready community. They're already out there. If you've gone to any of the community sites where physicians are congregating, they're looking for a place for this. So really approaching this in a top-down manner to engage them and saying, we have a solution, we want to partner and work with you, knowing that they have the support of KPMG and everyone on this platform, I think really allows you to have the right first, second, and third meetings. Congratulations for thinking of this, doing it, and for reaching out and frankly sharing it with all of us.
Thank you so much, Dr. Pigas. Brian, I would like to offer you an opportunity to unpack this. I know you're very enthusiastic about this one.
No, I just liked that it really did reflect a really deep understanding of the situation on the ground, which so often as technologists, you can envision what you think the problems are from reading headlines or from, a few interviews, but it was really clear that this was somebody who understood the relationship between hematologists and blood banks and hospitals and the role that verifiable credentials can play in building this, right? It's not just about putting it all on the blockchain and making it all transparent. With verifiable credentials, you actually have the sophisticated balance between privacy rights, because the rights of these patients are the privacy rights of these patients, both the giver and the donor and the receiver, are super critical to protect. So verifiable credentials allow for that sophistication while still supporting an app like this. So I was really happy to see that, and just happy to see the polish on this presentation too. And I agree with Dr. Pigas. I think this is something that can be rolled out very quickly. If it finds the right partners and finds the right willing set of early adopters, basically.
Thank you, Brian. Joe, please go ahead.
Yep, I like this one. It makes use of the important cryptographic primitives, pseudonymity, verifiable credentials that we're looking to see in so many different solutions going forward. It generalizes easily. It's a good architecture, a not too complicated architecture. It generalizes easily to new use cases, can be extensible, I think, for higher security use cases, where you replace the single hematologist signer with potentially a set of signers. So it feels like a system that should be built and should be deployed.
Absolutely. Debbie, I'd love to hear your thoughts on this one.
Well, Brian kind of covered the verifiable claims and the importance behind it, and that was, besides truly understanding the use case, the forward thinking about what would be needed for privacy and security, that was the key for, at least in my vote.
I think what's really interesting is that, and I've just kind of been learning this over the last year, but identity and access management authentication, those things in basically every industry fundamentally need to change. And they're very inflexible, whether you're in government or you're working for a financial institution, real estate firm, insurance company. And, Well, I fully didn't. I don't know that I actually understood this case as much as some of the other ones. I think the point on strong identity access management, that strong authenticating capability allows this to be very disruptive and applicable to a number of other spaces. And then the question for this one is, and I think they're functioning right now. That's what I understood when I watched it. But the question on this one is like, how quickly can you get folks to actually be a part of the network and engage? But again, I think the strength is it's a modern identity access management authentication capability that's super flexible. And that is something that really, besides the use case, I think stood out to me and that I wouldn't lose sight of for that team.
I agree, of course, with all the panelists. I think that what strikes a special note with me is that the solution really stands apart by having us understand that tracking stuff, tracking transactions, and tracking people is not the same. And so it's a combination of all the three, and that's what's so fantastic about it. It's able to distinguish the fact that not only do we want efficient and secure and well thought matching engines, but also respect the security and privacy. And we talk about this so much, and this is so core to who we are as Consensus Health. These privacy preserving or dignity preserving technologies. I think that this is wonderful, and it is a solution that really brings us closer to realize that vision.
I agree with you, Dr. Kahana. The advanced privacy preservation and what we've been increasingly calling dignity preserving technology, a phrase that you coined, is so meaningful in this case.
I concur with everything that's been said about this project. It was great. I think that one thing also to highlight is beyond the aspects of the project, I really enjoyed seeing the deep plasma team engage across this entire process. One of the things that was unique about this hackathon was how well we brought together a group of health mentors with the hackers, and they utilized that process the whole time through in the open office hours and in engaging with the mentors. I think that made their offering just a lot more refined, and it showed in the polish at the end of it. And I think we're seeing that now as it helped it get to real world viability, faster than just the conceptualization itself. So that was awesome to see. From a research perspective, I love it because even though it's narrow now, as Dr. Pegas said, it can be expanded to a lot of different organ and tissue donations and transplants, but there's even a matching aspect that's applicable to research and finding research participants in very hard to find rare disease studies. So I think it's got a lot of growth potential beyond it too.
I also really like this one. And I think the points about how we think through the relationship between sort of blood plasma and this ecosystem and the existing ecosystem of transplants and those needs, it leads me to ask the question, how would we incentivize through this platform, potentially through tokens or other means, users to actually step forward to want to donate? Like, how do you get that sort of groundswell of a lot of people wanting to participate from that perspective? Because part of what ails the transplant industry beyond matching is actually availability, right? And so how can it exists, yes, but how do you move this to the point where, a lot of folks who have what people need in this use case are willing to step forward and sort of raise their hand to donate? So that's the sort of open piece of this that, looking forward to how the team is thinking or will think about how they implement that part of it.
Yeah, the underlying infrastructure for matching and optimization will be highly reusable, we think, and but also it was terrific seeing how focused and concrete the thinking was on this one. Dr. Kahana, you're raising your hand.
Well, I'm just saying that since I'm hearing, the aspiration behind it, I just want to say that one of the sentences that the group said in their video is really this idea of a vision of a global donation. And what couldn't be better than really exercising radical empathy by having global blood donations that crosses all borders and all jurisdictions, where really we help everybody with something that is so close to our heart, and that is our own blood. And to know that this technology can be the backbone that what really connects us as human beings, for me, is just really fantastic. And it just goes beyond I would say, making things faster, cheaper, better, but really reminds us who we are as human beings.
we all acknowledge that accessible healthcare is healthcare. And the ability to introduce solutions into the ecosystem that improves access is really what this is all about. And it's what we all strive for. And I think any time you see a young company really focus on that and not only say we can do it in our technology, but we understand enough that there's a global need. It says that this work is team-based, right? It requires clinicians, it requires communities, it requires technology platforms, and then together having that strategy in place to allow us to achieve these goals. I really liked the comment by Sean of just the ability for this group to utilize their mentors. It speaks to a lot of how businesses succeed. It's how do you use expertise? I think Jose has been sharing a lot of that on this call today, of how do you use experts to help you not always restart at the bottom, but you're really taking a huge leap and building upon what came before you. And I think that was very noticeable with this group. So congratulations again.
Yeah, I think what struck me is that at its foundation, blockchain technologies is distributed public key infrastructure. It breaks down those barriers of borders, and it really facilitates communication and collaboration across those borders. So, and I think cryptographic signatures, I think, is from, at least from the signatures, physicians or medical providers are at the heart of your identity from birth to death. So physicians sign your birth certificates, they sign your death certificates. And it really is that next level of application to technology of cryptographic signatures to facilitate that trust across borders. And that's why this was my favorite.
Thanks, Dr. Holt. And Juliana, representing the D-Plasma team, congratulations for winning the first prize. Everybody, this is amazing. So this is your opportunity to react to the judges' feedback. What have you to say to the judges?
I think first of all, I need to thank the 2 hospitals next to my house to borrow the defibrillator because I just had a mini heart attack. It's really a pleasure it was a combined work of all the team members, all the mentors. I would really appreciate KPMG for this prize, for all the judges that could see that. And I hope this is the beginning. This is not the end. This is just not the prize that we received, but we would like to work together in the future to make this project a reality.
Thank you so much, Juliana, and congratulations to the D-Plasma team. And actually, that's a perfect segue into one of the things I'm very excited to tell all of you, which is that this story is not over. You are witnessing the close of a chapter, and more is to come. If you'd like to know what happens next with the evolution of our projects, please join us on June 18th at 12 p.m. Eastern Time, approximately 1 month away. And before we wrap up today, I want to make sure that everyone who's listening to this understands that this was a massive effort that was not possible without the very active support and engagement of many incredible organizations. First, I want to thank our main sponsors, Consensus, Hyperledger, Gitcoin, and OpenMind. And then our 2 prize sponsors, KPMG and Leidos. Thank you so much. Our technical partners, Kaleido, Infura, OneUp Health, Trium, the British Blockchain Association, 1 Million Developers, and Encryptgen. And our academic partners, Thomas Jefferson University, William and Mary Blockchain Lab, and the Pepperdine Business School Blockchain Program. Thank you very much to all of these participants, as well as to the large number of healthcare and life sciences volunteer mentors who taught, trained, coached, worked, all at personal sacrifice in support of all of these projects doing incredible work. So I want to remind you all that a part of our mission for this is to put momentum and to maintain forward progress on all of these projects. D-Plasma, our other winners, and also some runners up that were very close, Cabana and COVID Safeguard, for example. So I would love to remind you to visit the Consensus Health website soon to be able to register for the June 18th follow-up. Believe me, there will be a lot underway. Our technical partners, our other partners will be engaged, and we can't wait to keep the story unfolding as we all are living through this pandemic.